Okay, today we're going to do an IV insertion. The first thing I want to do is come and check my orders, and what I've looked at my orders is that the physician wants a saline lock started for blood because blood's going to be given later on today. So that kind of determines what size and the location of where I'm going to be starting the IV. I'm going to probably start the IV more in the forearm versus the hand because of the blood product that I'm going to be giving. So I'm going to get my tourniquet, get it on nice and snug, and I'm going to look for my vein. So I'm looking down here, but like I said, there's some good veins down here, but I'm going to be giving blood, so I'm going to want to go up a little bit higher. I want to make sure I get a vein that's at least 2 finger lengths in length, and one that's, bouncy, one that doesn't have the bifurcations, such as the V's, or if I can see valves or feel valves. I want to avoid all those. So I think this one looks pretty good. That's where I'm going to go. So I'll undo my tourniquet. I will get my ChloroPrep. Snap it so it activates it. I'm going to clean my vein off. I'm going to clean a good portion of it off just in case I decide to go in a different vein really close by it. While that's drying, I'll get some of my other things ready. One thing too, I would have determined left-handed or right-handed. Items that you want to avoid is if they've had a mastectomy or a shunt put in for dialysis, or if they've had a stroke. I can also ask him if he's left-handed or right-handed. My tourniquet open, or my cannula, and I've got an 18 gauge because of the blood product. I need a 2x2, so I'll open the 2x2. I've got my extension tubing because that's the type of saline lock that I'm going to be using. I'm going to prime and get it ready. So I've got my flush here. I loosen this up a little so I don't get the fountain effect. And get the air out of that. And then I'm going to take my saline lock. Sterile to sterile. If I had any doubts, I would have wiped it off with alcohol and get it primed. Next thing I want to do is just loosen this cover up so it's ready to go when I am and I don't have to fight with it. The last thing I want to get ready is my Tegaderm. I'll wash my hands and make sure the patient knows what we're doing. If I had any troubles finding a vein, some things that I could do is I could go ahead and tap the veins gently, and that'll engorge them some. He could lower his hand below the level of the heart, and that could make the veins pump up. Clenching of the fist, that can help. And what always works really well is if you use warm packs. Put warm packs on for about 5-10 minutes and those veins will pop right up. So now I will put my gloves on. I've got my tape ready for afterwards, and we're just going to do a U method afterwards. Got my gloves. I'm going to reapply the tourniquet. Should be approximately 6 inches above your site, but nice and tight. And then I'm going to be looking at my side again. Don't want to touch it again though. Then I think I am ready to go. Now I don't have blood hooked up to this mannequin, but we're just going to try and simulate it the best we can. So you want to make sure that your finger is right on the little notch here so that your cannula goes in correctly. You have to hold the skin tight, hold it taut, so that otherwise if you're going in, if you're not holding it tight, then the skin's going to go up with you. So hold it nice and tight. You start at approximately a 30-degree angle and you go in. Now a lot of times you're not going to see blood right away, so then maybe you have to come out a little bit, go over to the left. The veins will roll. So let's just say, oh, there I got some blood return, bring my angle down even further, and then I'm going to let my tourniquet go so I don't have to go against the stream. And I'm going to start advancing and pulling out the needle at the same time until I hear the click. Now I'm going to tell my patient to hold real still. I'm going to go ahead and hold still. Otherwise that IV will come right out. Got my new one. Go ahead and just stabilize it, but I don't want to put it right over the insertion site. Next thing I want to do, get my 2x2. Keep it as sterile as I can, because once I take this off, it's just an open road right to the vein. So now the next important thing you have to do is right above the cannula, not on the cannula because that will hurt, but right above where your cannula would be, you need to put pressure. Then you also have to stabilize. Actually, what I should do next is put the tegaderm on. Sorry about that. I don't want to contaminate my site. Again, where it comes across there, that's where it molds on the best. Now I'm okay. Get this, I'm still sterile. I'm going to put the pressure, I'm going to stabilize, take my off, and put that on. The 2x2 is there just in case you would get a drop of blood, and then it also acts as a sterile field. I don't need that anymore. You can always leave it if you want. I will aspirate now, and technically I would be getting blood back just to verify that I am in the vein, and then I would go ahead and flush my 2 mils of saline through. When I'm flushing through, I'm verifying that there's no infiltration going on, which you would probably see a goose egg happening there. Make sure there's no resistance. That means that it already clotted off. And make sure there's no pain. If there's pain, something is wrong. So I flushed, it went through well. I can take my flush off. I can take my gloves off. Next thing I want to do is secure this. You have to secure this down well, or it's going to get caught on linens and whatnot. So I'm just, for this matter, I think that'll work fine. That's going to go on the sharps. The last thing I think I need to do is sign here with the date and my initials. Take my piece of tape off and put it on the side. Alrighty, I'm going to go out to the computer and I'm going to chart. The things that I need to chart that are important with this is the size of the needle, which is an 18 gauge. How many attempts did it take? It took me 1 attempt. The other thing I want to put is the site, which would be the left forearm. If there was any complications or if the patient had any troubles, you could chart that also. Date and time, whatnot. If there was any fluids that I hung with it, like such as my saline, or if it was with my blood, I would also hang that, or chart the fluids that I hung, and I would chart the rate that I'm hanging them on, and if a pump was being utilized. So I've got my IV in, and I've charted. My patient is safe. I would do all my standard post steps, and this completes my skill.